We need to know why there have been breakdowns in it and if our system for responding to such serious crises is working properly. That was a line I was supposed to read. I think we all know that the system is not yet refined to where we could say it is working properly.
That from Congressman Darrell Issa this week, criticizing the Obama administration's response to the Ebola crisis. Is the administration doing enough to fight this dreaded disease here in the U.S.? Joining us now, Fox News contributor and the former director of pediatric neurosurgery at Johns Hopkins, Dr. Ben Carson. Welcome, sir. Great to have you here today.
Thank you. Good to be back.
Let's talk for a moment. I know you've had some real concerns about some of the procedures and protocols that have been in place. What do you make of these latest protocols, putting people in quarantine shortly after they arrive in the United States if they've been in contact with folks in West Africa?
Well, certainly it's better than what we were doing before. As I've been stating for many, many weeks, it's a mistake to bring this disease into the United States under any circumstances, particularly when we can treat it elsewhere and then bring people back. And the reason is not because we don't have excellent infectious disease people and good protocols out of the CDC. It's because of human error. There's always going to be human error. So when you're dealing with something this dangerous, why expose the population to it? Several other countries have seen fit to ban flights from the areas of infestation. That only makes sense. This is not going to be a permanent ban forever, but until we get this disease under control, recognizing the potential for problems, we have a tendency to always plan for best case scenario. We need to plan for worst case scenario. And we need to also concentrate the effort, I think, in West Africa. Get the resources and the people that we need to obliterate this disease there.
Over there first.
Right, because if it spreads across the African continent and then into the Middle East, where, there's some real hygiene and issues going on there, the spread could be very rapid.
Well, we have these protocols in place right now, for example, at JFK Airport, and the doctor who's right now in the hospital in New York, he apparently passed the test that was set up to take the temperature of individuals there. Now, that's supposed to be in place to help us feel like the situation's under control, that the feds are doing something about this to protect us. And yet, he contracted the virus days later. I mean, he developed symptoms and ran around New York on a subway, went to a bowling alley, went to a restaurant.
Exactly.
I mean, this is just irresponsible. But at the same time, he followed the procedures that are now in place in New York.
Which, if people just stop being proud and can just say, we were wrong, let's re-examine this, and what could we have done to have prevented that situation? What could we have done to prevent Mr. Duncan from getting in here? What policies would have kept that from happening? That's what we should be doing, rather than trying to cover our tracks and find ways to make excuses. Let's not do that. And this is not to say that we don't have excellent care
But they're putting a lot of emphasis, though, also on self-monitoring. People are supposed to report to the government, to the officials, about their symptoms. They're supposed to be checking in on a regular basis.
Which is absurd.
People are not going to do that.
Of course they're not. And, well, not only that, but remember the nurse in Dallas who called to tell them she had a fever and was not told that she could not fly.
Right.
So, I mean, we don't even have the protocols correct. We don't know what we're doing.
Well, we have an Ebola czar, but we really haven't seen much of him in the last few days.
Right.
What do you make of that, the fact that we have a czar in the first place?
Well, I don't want to get started on my opinion on czars. They're unconstitutional. They don't answer to anybody. There was never any provision for them made. I don't think that's the correct way to do things. We have excellent people at the CDC. We have, Secretary of Health. These are the people who should be running this, and we should be utilizing the tremendous expertise we have now. I would caution the American people not to panic, because we have a number of people who are working on a vaccine, and they're very good. And my understanding is they're making tremendous progress. So I do think we will have something before something really horrible happens. But to preclude the horrible things from happening, we need to be planning for worst-case scenarios, be ready for those. We need to go ahead and put the ban on. They probably will eventually do that. But what has to happen?
Certainly get closer to the election politically. Do you think it's going to be timed that way?
I don't know. I mean, they will. But we're always a dollar short and a day late. You know, why can't we be out in front of things rather than always bringing up the rear? I think that's the thing that makes the American people worry about us. And we have smart people who know this, but we also have people who are just intransigent. I'm right. I don't care what anybody else has to say. This is not what works in anything. A little bit of humility works a little better.
When we're talking about lives that are at stake.
Absolutely.
Dr. Carson, it's so great to have you here. I know you have a new book out called One Vote, and it's something that a lot of folks should pick up and take a look at.
Well, it's to get the American people to understand that we are at the pinnacle of power in the system. But in order to exercise that, we must be informed, be an informed voter. So you can go online and actually get a free copy, makeyourvoiceheard.com, and teaches people who your representatives are, what they believe, how they voted, not how they said they voted, but how they actually voted. So you can figure all this stuff out fairly easily, and it's really worth your while. You know, it's very much more important than going to a basketball game or a football game or a rock concert. And
really quickly, though, lots of folks still are hoping that you're going to make a decision soon about 2016. Are you any closer to that?
I'm thinking carefully about it. I'm listening. You know, it's still not something that I want to do, but every place I go, I'm being told that I have to do it. So I'm listening to my compatriots, and I will continue to do that.
Always great to have you here, sir.
Thank you
so much for joining us with your insights.
Pleasure.
Appreciate it very much.
Okay.